Forecast now back over to Eric and Wayne.
All right, thank you very much. Along with patients' rights comes patient responsibilities. Is there something you can do to protect yourself from being the victim of medical malpractice?
Well, this morning we'll have advice from a New Orleans attorney who specializes in malpractice cases. Stay with us, everyone.
Let's go over to Wayne now for the rest of the medical news.
I think I knew that already. All right, Eric, thanks so much. Well, we've all heard the horror stories at the hospital. You've heard things of people getting amputations that they didn't need, or perhaps the wrong medication. We expect doctors and nurses to take care of our medical needs and not put us at risk, but is there anything that we can do to help out in this case? Attorney Frank Beahm joins us this morning to give us some advice in this. And we should point out right off the bat that you represent doctors and nurses who are accused of malpractice. And a lot of times when things happen, they are not the desired result. Does that necessarily mean it's malpractice?
It does not. There are known complications in medicine that occur even in the best of care, and there's nothing that you can do to avoid it. The best thing to do is that the physician recognizes the complication and addresses the complication.
But I mean, you can't argue with the fact that mistakes do happen, and sometimes a lot of them do, and they can be pretty serious.
I'm not naive enough to realize that there aren't errors that are made. There are. Every day there are errors that are made. Clearly, to me, the key to success for treatment for any patient and the patient's family is clear communication with the physician, get a clear understanding of what the goal is for the treatment, what the ailment is, and what the alternative treatments are.
You say we can really take charge of this by making sure we know what all the complications are, what are the risks, what could go wrong, and so that we can decipher what that is as opposed to something that shouldn't go wrong and did.
That's correct. And just don't blindly follow your physician's advice. If it feels right, it probably is right. If it feels wrong, it's probably wrong. Get a second opinion from another physician. It's real easy. You control your own medical care.
And a lot of times you see things, which are honest mistakes. I remember being in the hospital and I had 2 types of pain medicine prescribed, and I asked for my just regular pain pill, and the nurse accidentally gave me the big mega pain, and I was knocked out for a while. It was an honest mistake, but it happens, and the consequences can be severe for some people.
It can happen. And in a hospital setting, if you have a patient who is not necessarily cognitive completely, a family member should stay with the patient, inquire of the nurse, what is the medicine that you're giving to the patient? Is it the patient's medicine? Because sometimes they do get mistakes and switch it up, and that can cause a problem, just as you described.
What do you think is the state of just the medical malpractice lawsuits here in our area? We have heard arguments that, in fact, because of the amount of lawsuits, it's making it much more difficult for doctors to do their jobs, for them to get insurance. Where does that stand in Louisiana?
Well, in Louisiana, since 1975, we've had the Medical Practice Act in place, and that puts limits on recoveries for victims of medical malpractice. And the statistics are kept by the insurance companies, and I'm sure that they're quite exact. But from my experience, since Katrina, the arisings of lawsuits in the metropolitan area of New Orleans are down. Now, I've spoken to my colleagues across the state, and they tell me it's business as usual. So it continues.
All right. All right. Well, thank you for joining us today. We appreciate the information. It's pretty knowledgeable.
Thank you for having me.
All right. Well, we're going to have another check of morning traffic coming up for you in just a couple of minutes, and we'll head back to the kitchen to check in with Frank and Mary Claire. Stay with us, everyone.